Hello everyone. So it's been a few months since my mastectomy, since I made a video, so I felt it was time. I just finished 36 rounds of radiation yesterday and I made it. So I'm super excited to have that checked off my list as another thing through this journey. So perhaps you're like me to where you didn't know what radiation even looked like, what it felt like. What I tried to do was I took pictures along the way, everything from my simulation to getting tattooed to the actual radiation part and also the boosts, which, so I had 28 rounds of radiation and then 8 boosts. So I'll talk about what that is and how that's different from the regular radiation that I received. So I'll talk through some of these pictures, and what I'll end up doing is making another video about how I survived 36 rounds of radiations, because I really did have minimal pain throughout this journey, which was surprising. And that was probably the most thing I was scared of. I was almost scared of radiation more than I was of chemo. But again, I think I worked myself up over nothing and realized, just like anything else, I could get through this too. So let's take a look at what to expect getting ready for radiation. So as you get ready for radiation, they do a CT scan. So one of the nice things about this is that you didn't have to have an IV of any kind, because every appointment you kind of start to wonder like, oh, am I going to have to get pricked again with a needle? But when you went through the simulation, or when I went through the simulation, I did not have to. You also undress from the waist up, so your pants, shoes, socks can stay on as you get ready for the simulation. So I knew going into radiation that I was going to have to be fitted for a mold to lay in each and every time I went in. And this is what that looks like. So laying down into it, it just felt like a bean bag. And then once your arms are situated, they suck the air out of it. So this is the end result of that mold being made that I would use each and every time for radiation. So when you're getting fitted for the mold, basically you're just lifting your arms up, holding that bar, and then that's when they suck all that air out so that that mold conforms to exact position that your head is in, as well as your arms. So once you're all fitted, you go through the scan. This is going to help the doctor come up with a treatment plan for you, which they'll use whether you have the radiation or also the boosts as well. So the last part of this process was getting tattoos, very small, just like the tip of a pen, and I received them in 3 different areas. I have 1 tattoo on each of my sides, so that's 2, and then 1 right in the middle. And this is what that looks like once they are finished. So here's a picture of my very first tattoo. Did it hurt? Sure, maybe a little bit. They're so small. It's nothing. You can see I have a few other moles in that area, so it really wasn't anything big. Maybe where you get radiation, they would allow you not to have a tattoo. Maybe they have different options, but for me, these small little dots are really nothing in the big picture of what I've been through. Okay, so that was it. Pretty painless. The whole appointment for that simulation was about 30 minutes. And then from there, it took about a week and a half for the doctor to come up with my treatment plan so that I could get started. So once that was complete, I was able to start my 36 rounds of radiation. I didn't know what the radiation machine even looked like. I was thinking going through the simulation when I was getting my CT scan, I was like, is this the machine that's going to give me radiation? I just didn't quite get it, again, because I just didn't know what the whole process even looked like. So that was not the machine that was going to give me radiation. Here's some pictures of what it looks like to receive the actual radiation to your body. So before heading back to radiation, I had to come to this area to confirm my name, my date of birth, and also my picture. So this is kind of like their control area where they could talk to me from this room, and they could also see me by way of a camera. So this is what the actual machine looks like for radiation. So they have my mold out on the table every time I come in, and I undress. I take my arm out of the robe for the area that's getting radiated. And then I also have to lift up the other side that's not being radiated so they can see the tattoos, and they can line me up with the red lasers on the wall. So this is once I'm in the machine. Your arm's in the same position. Again, even your head has to be turned in the same position.
And this is just, you know, pictures of the other lasers that are kind of all around you to make sure everything is lined up with your tattoos. So this is the angle, one of the angles that I get radiation at. So I get it at 3 different angles. I did block out that breast area, even though I technically do not have a breast. I just figured I would for the internet. But that machine goes around me at 3 different angles, and it buzzes, makes a sound. That means you're getting the radiation. Then it moves the position, makes another sound. So 3 different times. Again, the actual appointment for radiation probably took about 6 minutes.
So that was just a little snippet of what to expect. Pretty painless, and honestly the only thing that hurt was lifting my arm all the way up at first, just because I had my lymph nodes removed, so this area was very tight and tender, and leaving it up there for that long, maybe the first week or so, I experienced just some discomfort, but it wasn't anything crazy. So you do not feel anything like as far as pain from the radiation coming onto you during that process. So my appointments took typically from maybe 6 minutes to sometimes 20 minutes, because every week, maybe on Mondays, they would have to do an x-ray of that area. And again, they just have to get you lined up exactly. And if I even like would breathe, like, cause sometimes when they're like working on you and they're tugging you and they say a quarter roll this way, or a tug that way, you kind of get tensed up a little bit. And then when they would leave, you would kind of relax. Well, then once you relax, you kind of move a little bit, so they would come back in the room. So there was one day they kept coming back and forth, like at least 4 different times, because I kept moving without even realizing that I was moving. So overall, not a bad experience. So I want to talk about the boosts. So my radiation kind of went from up here all the way down, all the way over here. So like my underarm is super brown. It's starting to peel right now. But the boosts is where they target just my mastectomy scar. So my cancer was, that was left, and like they didn't get all the cancer from my mastectomy, was kind of in that area. And she also, like my radiation oncologist said that like when they do the mastectomy and they pull your skin, they're also pulling tissue. So they target that area specifically for that reason. So here's a few pictures of what it looked like to receive the boosts. So when I initially had my CT scan, this is that image that came from that, and you can see where they're targeting my mastectomy scar in this photo here. So from that scan, this is what was created to fit into an attachment to the radiation machine. And you can see here, that's the attachment that's now on there to target my mastectomy scar, and that piece just fits perfectly in there. The machine is a little bit closer for when you receive the boosts. The boosts are super quick compared to the regular radiation. It probably takes like 3 minutes from the time I change to the time I get back to the dressing room to change again. Another side note to the boost is that you no longer need to use the tattoos anymore to be lined up. So during the boosts, they put on like this clear plastic thing over your skin that's called a bolus, and it acts as breast tissue to help target that area even more. When I initially met with my radiation oncologist, she was hoping to get me at least through 5 of the 8 boosts. Well, I was able to do all 8 of them because my skin held up so well. The side effects from radiation, however, are burns. So I knew I was going to burn, and I did, but it wasn't as bad as I thought it was going to be. It might be because, though, I lost a lot of feeling when I had my surgery, my lymph nodes. So I don't have a lot of feeling here, which is the darkest part. I don't have any feeling along my mastectomy scar as well. The fatigue probably hit me on week 2 or 3. I would start to get tired around 1 o'clock, which is when my appointment was. And then it became earlier and earlier throughout the day. So it would hit me like at 11 o'clock. And if you've had chemotherapy, it feels similar in that you're kind of just in a fog sometimes. So focusing became really hard. Just wasn't really feeling motivated, but I was able to make it to work every single day, go to radiation in the afternoon, and then go home after that and work from home. So I was able to just, go to work, go to radiation, go home, rest, and just build my strength back up again. So I did work completely through radiation. So that's it. I am going to be making a video on how I manage those side effects, what I did specifically for my skin from day 1. Again, I'm really, really happy and pleased with how well it looks. And the worst part actually is just a rash I have along my chest. It itches, but I'm addressing that as well, and I'm completely fine, and so I'm smiling because I'm done. I did it. I'm so proud of myself. Hopefully this helps someone out there, and stay tuned because I will be making another video soon. Thanks everyone.